Hello everybody, that's Vincenzo Piccolo from Dermatology Unit of University of Campania Luigi Vanvitelli from Naples, Italy. And as usual, today I'm going to have a brief presentation on a very new topic for dermatologists and general physicians about human monkeypox. What do we know? Let's go through this picture that was extracted from a new paper submitted to in European Journal of Dermatology. This picture belongs to a 45-year-old man complaining the appearance of this grouped nodulonecrotic and ulcerated lesions of the penis and the scrotum, in which cutaneous lesion coexisted with flu-like symptoms. The most important information about history of this patient was that symptoms in this man had started 10 days after a sexual and homosexual intercourse with a partner, that a few days after their relationship developed a very similar but widespread papulovesicular dermatitis with fever and local adenopathy. I'm attaching another picture from this patient. So together with these grouped lesions of the anogenital area, a similar lesion of the chin was visible. Because of the association of these very peculiar lesions with fever and flu-like symptoms and lymphadenopathy, a diagnosis of human monkeypox was suspected and then confirmed by cutaneous PCR for the virus. The patient was immediately isolated, but obtained a full recovery of his condition in 10 days. This is a table extracted from the same paper I told you before about a very small cluster, Italian cluster of human monkeypox. In this table, you can easily understand that the diseases affected exclusively male, adult male, in our case, or with homosexual orientation. Systemic symptoms were seen in all the patients in association with swelling of lymph nodes. An associated HIV infection was seen in half of the patients, and the diagnosis was confirmed by PCR in most cases. But what do we know about this human monkeypox? This very schematic picture, but useful, comes from CDC, the Centers of Disease Control and Prevention websites. And with this picture, you can understand the association of cutaneous symptoms that are probably the most common ones, together with the flu-like symptoms, fever, joint pain, headache, and others. This is a large paper report published by Thornhill and other collaborators on the New England Journal of Medicine about the clinical features of a novel disease like monkeypox, in which the authors collected the characteristic of 528 cases of confirmed human monkeypox from 5 continents. Most men in this case series were homosexual. mostly coming from white ethnic group with a median age of occurrence at 30-year-old. Most of the patients were also affected with by HIV infection, like in our cases, and the majority of these patients were back from travels in another country of European country, predominantly referred by the patient themselves. This is another picture and table extracted by this very interesting paper that I invite you to read, in which the evolution of cutaneous and mucosal lesion is seen. And on the right part of the slide, you can see which are the reported clinical features in this paper, with rash or cutaneous lesions seen in 95% of patients, fever in 62, lymphadenopathy in 56, and after that we have other aspecific flu-like symptoms. What is very important is that the diagnosis is usually made through PCR, like we did in our patients, PCR on skin material, on skin lesions or anogenital lesions. Sometimes we can use nose or throat swab or blood or other areas of the body to detect the virus. So, in summary, we don't know so many things about human pox virus because it is human monkeypox because it is not an endemic disease in our countries, but we know that is induced by a DNA virus named HMPXV, human monkeypox virus. This infection is endemic in West and Central African regions, and now is coming predominantly in European and American countries too. Mainly, it is characterized by sexual transmission, even if a possible respiratory contagion, but rare contagion is possible. Homosexual men are mostly affected. In no case serious till now, all men were among patients, no females, and in particular, a man who had sex with other men. Most patients presented with predominant cutaneous lesions and associated systemic symptoms like flu-like symptoms, fever, headache, joint pain, and things like that. PCR is diagnostic to obtain the diagnosis and then the isolation of the patients affected by this new disease. The PCR can be obtained from skin or throat for diagnosis confirmation. And finally, complications are possible, but the disease is rarely fatal. Hoping to have given some useful information. Thanks for the listening. Bye.